When we're thinking about how folks deal with knee arthritis, it's as simple as saying, well, I have pain at night. I can no longer ride my bike for exercise. I'm challenged to get on the ground with my grandchildren. I think as you're considering treatment for your knee, what we're hoping you get out of seeking that treatment is the ability to return to those activities. Most people will talk about having pain that localizes or they feel at their knee joint. Some people talk about it being sharp. Some people talk about it being more like a dull ache, like a toothache. And some people say it's obviously worse with activity, where it depends a little bit on how much weight bearing they're doing or how much weight you're putting on your leg. It usually is a little bit progressive as well. I mean, it gets worse with time. When we're evaluating someone for knee arthritis, we evaluate your range of motion, muscle strength, stability of the knee. One of the most common things we do, besides of course a physical exam, is really to start with plain x-rays, And what we're looking for is a loss of the joint space, or really evidence in the x-ray. It looks like you've worn some of the cartilage away. That's sort of what arthritis is. It's wearing away of that cartilage or padding at the joint. The causes of knee arthritis, there are multiple, and the most common is what we sort of call wear and tear arthritis, or degenerative arthritis, or osteoarthritis. And so if we're around long enough, a percentage of us are going to develop enough wear to where you'll develop arthritis in the joint. There's other times where there are different causes. So post-traumatic arthritis means that somebody at some point had an injury, and you probably get set up for wearing away the cartilage or having damage in the knee quicker than if you hadn't had that injury. The other conditions or type of arthritis is inflammatory arthritis. And those are things like rheumatoid arthritis or psoriatic arthritis, where there's a disease state that causes enough inflammation of the joint as part of that condition that also creates the same process. Our intention is never to talk you into knee replacement. Our preference would be to figure out if there's these conservative treatment options, these things short of surgery that can help you get back to your quality of life you enjoyed before this knee pain didn't become an issue. And that's things like physical therapy, oral medications like Tylenol, acetaminophen, and anti-inflammatories. Even some supplements are often helpful for some patients. We certainly do injections, different types of injections. There's more than just steroid injections. And we think all of those things should be offered to the patient, because again, a percentage of the folks we see with knee pain, they're not all going to end up having their knee replaced.